the Doheny Eye Institute and is a board-certified ophthalmologist. And Dr. Manger is an expert in LASIK surgery. Industry reports tells us that there are 64 LASIK surgeons right here in Orange County, and Dr. Manger does 35% of all LASIK procedures in Orange County right here at Saddleback Eye Center. And Dr. Manger has superior outcomes. 99.7% of Dr. Manger's patients are seeing 20/20 or better, and the other 0.3% who don't are seeing at 20/30 and are very happy with their vision. And as we mentioned, no one has ever lost their vision by having LASIK here with Dr. Manger. And Dr. Manger is considered to be the most experienced LASIK surgeon on the West Coast, having personally performed over 75,000 LASIK procedures over the past 18 years. And he is the only LASIK expert in California, having just one office location and one specialty being LASIK only. And our staff is 100% committed to LASIK. This is all Dr. Manger does, 5 days a week, 50 weeks a year. Unfortunately, about 98% of LASIK surgeons in the U.S. will average about 3 to 4 LASIK procedures per month, whereas Dr. Manger routinely performs between 200 to 300 LASIK procedures each and every month. So he is the leading authority in the world for LASIK. So you are in very good hands with Dr. Manger to do your LASIK. So now I would like to invite our guest speakers to come up one by one to share their experiences with you. And first we have Shelly. So Shelly had LASIK with us on March 16th. Her vision before LASIK was 20/80 and vision after LASIK 20/20.
Hi everyone, I'm Shelly. I had been wearing glasses probably 7 years or so, and my eyes were great up until then. I could see distance far, close up, and then slowly but surely they just went downhill. Starting at age 50, it just went whoosh. And so I got my little glasses, you know, from the little reader glasses from the pharmacy. Wore those for a couple years. Then finally those weren't working, and I decided I need prescription glasses, so I got those. Well, as you all know, it's pretty hard to keep them where you need them at the exact time you need them. You know, you have a pair upstairs, you have a pair by your bed, and downstairs, whatever. I was getting so tired of that. A lot of times I would go to a seminar or something, and sure enough, I would forget my glasses, and it would just ruin the whole thing, because I couldn't see. I just had to just listen. So I just knew it was time. My husband used to be in the eye business, so I kind of knew a little bit about eye surgery, but I have heard of Dr. Manger for years. He lived in the next neighborhood over, so I actually saw them driving around the neighborhood with LASIKs on their license plate. So I've known about him forever, and I just knew when the time came, there was no one else I was going to even approach except him because of the amount of surgeries he does. I mean, it just, why would you want to go to someone that's not an expert in the field? My husband's in the medical field, and I was an ex-pharmaceutical rep, so we've seen a lot of things that have gotten botched over, you know, by not going to the best surgeon or trauma surgeon, whatever it may be. So anyway, I got the glasses, wore those for a while, and it was just mind-boggling to see, not be able to see clear. I first noticed it like a couple years ago when it really started bothering me, when I was sitting at the dinner table with the family, with my 2 kids. And I literally couldn't see their faces from here to there. And I put on my glasses and I went, oh, wow, that's such a big difference. Then my glasses started to not really work that well. So I thought, there's something strange about this. So then I came in a year ago by hearing Dr. Manger's commercial on KFI, and I came in, didn't realize that I was going to be asked to have the surgery that same day after they ran all the tests. And I was a little apprehensive about that. Got through that part, then my husband gave me the bad news that the funds weren't there. So I'm like, oh, I was all ready. Vanessa, I was like crying with Vanessa. I'm like, anyway, so I came back. We finally, as soon as my husband said, okay, you know what, made some deals, and so have I, and the funds are there. Let's have you do the surgery. I called her on a Friday, and I scheduled my surgery on a Monday. And I'm 2 weeks post-op. The next day after my surgery, I was 20/20 close-up. Distance was a little bit blurry, which is very common. It's getting better. Today, my distance, by the way, for the 2 weeks and 1 day post-op was really good. So I would call it, you know, pretty close to 20/20 at a distance as well as close-up now. But the one thing I have to tell you that was so exciting for me now that I've had the surgery,
Farsighted patients, who are farsighted patients, their vision is instantaneous. The far vision takes years.
yeah, so I had 20/20 the next day close up for reading, which was incredible. But the one thing I have to tell you that was so exciting to me is, I think about 4 days post-op or something, my daughter and I went to church, even though my eye was a little bit bloodshot, and I what the heck. And I looked over at her in the passenger seat of the car, and I looked over and I was like stunned at her beautiful eyelashes. I had never seen her eyelashes before. I didn't know she had bottom eyelashes. And then I knew she had long ones on the top, and I was just like, oh my gosh, Kayla, your eyelashes are beautiful. And then I'm, you know, so I just see everyone so much clearer, and it's just not frustrating anymore. It was so frustrating having everything blurry. So
Thank you, Shelley.
Thank you, Shelley.
So Shelley is a good example of somebody who had great distance vision their whole life. She was always a little bit farsighted. And you can overcome it for many, many years, and then there reaches a point you can't overcome it anymore. Your reading vision goes, and the distance vision starts to go. And that's kind of the scenario that Shelley was talking about. But a lot of places you go, they say, well, you don't have a good solution for, if you just your reading glasses, your main problem, we don't have a solution for that. Look, we've had a solution for that for 19 years. So the surgery works well for that. Shelley's also an example. She's the only speaker we had this evening that had monovision. So I did one eye for distance and one eye for vision. Thank you very much.
you're welcome very much. Thank you very much.
And now we have Michael. So Michael had his LASIK done with us on March 23rd. His vision before LASIK, 20/200, and vision after LASIK, 20/20.
Wow. I can read names. Hey guys, good evening. I actually came into Dr. Manger's office on Saturday the 21st and doing some reconnaissance for my son who needs LASIK eye surgery. There was never really any doubt if I would get it or not because I had been told no. But we were having some, I was grabbing a lot of the food. And Linda said, have you thought about getting eye surgery? And I said, well, no. She was coming in Monday. I got a slot at noon. Okay, it's free, what the heck. And I could use the day off of work. So I came in. So I had no, on one of the forms says, how long have you been thinking about laser eye surgery? I put 48 hours because it was not something I was planning on. But there's some numbers that, as I was thinking about what I was going to say, there's some numbers that came to mind. The first number that came to my head was 18. I was 18 months old when I had my first pair of glasses. The next number is 2. I was 2 years old. It was on my birthday, September 9th, 1963. I was 2 years old. I had eye surgery for a muscle problem. The next number is 11. That's when I had my second eye surgery. Same thing. Went up to San Francisco to the world-renowned ophthalmologist, Dr. Jim Polsky, who did my work on my eyes. Came out great. Still couldn't see. The next, but my eyes looked better because at 11 years old, when your eyes are crossed, it was teasing and the kids were making fun of you and everything. The next number was 3. I went to 3 surgeons, all turned me down for LASIK. I came here, Dr. Manger, at 20/20 the next day. On the drive down here, I'm reading every sign, every license plate. I was reading everything I could, because I could, without glasses. The next number I want to share with you is 1975. 1975 is not a year, but how much money I spent. $1,975 in the last 3 years on prescription eyeglasses and sunglasses. I've had sport glasses, I've had goggles, I've had everything. $2,000 in 3 years for me, the progressive lenses, right? I'm a pilot too, by the way. I didn't mention that, did I? Seeing's pretty important. I have my FA medical tomorrow, and it's going to be 20/20 tomorrow, so that's... my last, it's going to freak my doctor out. I already called him and freaked him out. But,
Is that with Dr. Cummings?
it's a Dr. Ralph Cummings right in the street here. I may stop by and buy you lunch. Or you buy me lunch, huh?
He had surgery here too.
He had surgery.
Dr. Cummings had it.
So the last thing I'm going to share with you, the second to last thing, last number I'm going to share with you is 433. I woke up day after the surgery. I got out of bed, went to the restroom, and as I turned the corner into our master bath, I could read the clock on the wall, and it said 4:33. I measured it. It's 10 feet 11 inches from where I could read it. Normally, I literally would have to go about that far to the clock to read it. So I'm in the bathroom crying because I'm so happy. Here's my prop. Good speakers always have props, right? I'm working on it. About 35 years ago, I remember praying one night, and I just asked God, I said, just heal my eyes. Just please. I mean, it just, if I didn't wear my glasses, I'd be in pain. I'd have headaches. It was terrible. I took off my glasses that night, believing that I'd wake up with great eyesight. It didn't happen. God said, no, it's not time. Well, on March 24th, when I woke up, I didn't need the glasses. And I believe that God used Dr. Manger and his staff, Linda especially, for even suggesting it to me. Because if you didn't say anything, I wouldn't be here. So thank you. And for the rest of the staff, it's just been, Carol's great, Vanessa, Ben, the guys in the back are great too. So I just want to say thanks, and I'm not going to need these.
Thank you. It's really mind-boggling that 3 people told him he wasn't a candidate for LASIK. I mean, he had about 2 doctors of astigmatism in one eye, and 3 doctors of astigmatism in the other eye. So you kind of wonder why. All I was doing was correcting his astigmatism. It didn't seem to be that hard. But I think what threw the other doctors off is Dr. Diorio's has a lot of experience. He's an ophthalmologist. He was one of my instructors, actually, in my residency program in ophthalmology. That was a few years ago, wasn't it? Yeah. But he would understand this because with the strabismus surgery, the 2 eyes don't work together perfectly. They're not perfectly coordinated, so he's got 2 eyes that are operating separately. But you can go ahead and, it's not going to improve that part of it, but it's going to improve that vision from 2200 to 2020. So his eyes are used to working out of coordination. He's done that for decades, right? So, but he doesn't have to have the glasses to correct that astigmatism, so that's the advantage he gave. So thank you very much.
And now we have Carrie. Carrie had LASIK with us on March 25th. Her vision before LASIK was 21,000, and vision after LASIK, 2015.
Wow. I think I'm 2020 now, though. If you guys check me again. Hi. I had LASIK last Wednesday, and I'm elated and so happy. I looked up Dr. Manger. I heard the commercial on KFI. My boyfriend told me about it, actually, and I heard it, and everyone was just like ranting and raving about you. So I went on the website and looked up, and you had some videos there, and I liked your personality, and you were really warm. And then the amount of surgeries that you had done, that blew me away, and I was just like, for me, that gave me confidence, because knowing that this is all you do is like, I don't I know that you have your craft perfected. Like, this is what you do, like, every day. You don't spend time diagnosing other problems. So for me, that just gave me a lot of confidence. And so then on the website, it says that you have the same day procedure. So I went to the bank and I took out all my money. And I had it in an envelope. And I was just like, I hope that this works out. I wasn't even sure. I like went to the bank and I'm like, I might be coming right back because I don't even know. Because like 9 years ago, they told me that I wasn't a good candidate for LASIK. When my eyes finally stabilized, and so I asked the doctor if I could get LASIK, and he was like, oh, your eyes are really bad, and you would need a lens replacement surgery. And I was like, never mind, I'm fine with wearing glasses, like, that's fine. And so when I took out my money, and I was like, I don't know, I might be just coming back with this, and she was like, whatever, the teller doesn't care. And so I just had my cash in my wallet, and when you said the other doctor said I was a great candidate, and I was like, that's when I just got really excited, and I was just like, it felt like I was at Disneyland or something. Like, I couldn't believe it, like, it was gonna happen, and like, I wasn't nervous at all. For me personally, I was just super excited, and it wasn't, there's no pain. It's not comfortable, of course, it's not comfortable to stare at a laser and feel like you're in some kind of like weird position, but it's just that's it. There's no pain. It's just like awkward, and they're so nice to you. They give you like a stuffed animal to hold on to, and he's like someone's talking to you like the whole time, telling you like what's gonna happen. And so I never felt like confused about like anything that was gonna happen, and I also felt really confident because you had so many doctors look at me even before you came in, and so I knew like it's not just one person and what they, what through the procedures of checking my eyes, that it's a few people's correlation and making sure that it's the exact, it's spot on.
Double check.
Yes, and that was like, I was like texting my boyfriend, I'm like, they're having me checked by like 3 different doctors. I'm like, this is awesome, because that just shows he's humble, and like, he takes into consideration other people, and it's just not just his word. So to me, that was huge. And he's so sweet, and he's so nice and so sweet. It's like, I loved it. So I'm so happy. I can't say, I'm just elated.
Thank you very much. It's awesome taking care of people like Carrie. She, really, again, though, here's somebody that was told they're not a candidate for LASIK. She was a -7 nearsighted. It's not that high a prescription, and I don't really think it's appropriate to do a lens implant on somebody like that. We many times get people -12 or -14. If their corneas are thick, then they could very well be a good candidate. Once in a while, we'll do PRK on somebody if their prescription is too high, but Gary had plenty of cornea there, so it worked out well. Thank you, Gary.
Good evening, my name is Vanessa. I'm the director